Hi, this video is about knee surgery and what to expect. I'm going to be talking about more specifically ACL reconstruction surgery. For mine, I actually had a multi-ligament damage, so I actually had 3 different procedures done at the same time, which includes an arthroscopic ACL reconstruction surgery, an MCL repair with a brace, and a meniscus repair. I will also talk about what it's like going into surgery, post-surgery. I'll also run through a few exercises that I've been taught and some things that you can do to help with the pain and what to expect, really. What pain levels are we talking about? Firstly, what happened? I was indoor climbing, and I have gone climbing for over 24 years, and it was like a million other times that I've gone climbing. Unfortunately, this time round, I decided on my last climb I was going to do a dynamic climb, jumping really from one hold to another hold. And unfortunately, I missed the hold and came falling down on mat, but 2 meters from the ground, and landed really awkwardly on one knee. I felt this springing on my knee, a bit like a rubber band getting pulled and then contracting again suddenly. And I felt this excruciating pain, like as if someone's hit you on your funny bone, but really painful, with like electrical signals going off in your brain. I went to the hospital, ruled out any broken bones, got some scans, and the doctors all said you're fine, no broken bones, but here's some Panadol and for your pain and an MRI referral. Go and see your GP. It took a week to get an MRI back. We found in the MRI that I had a ruptured ACL, a ruptured MCL, a sprained PCL, and a tear on my lateral meniscus. So quite a lot of things going on in a knee. It was pretty bad. I went to go see a specialist, and that specialist referred me to another specialist. The other specialist was more specialized, I guess, in arthroscopic ACL repair, and he's pretty good at getting people who are young and fit and pretty active, who want to go back to the sports that they do, put me into the system to get my surgery done in a week's time. So all in all, from the time it happened till surgery took about 4 weeks. So when I went into surgery, the surgeon did 3 different procedures at once. Firstly, he repaired my MCL with a brace. So the MCL can actually heal on its own, but because of the multi-ligament damage, my surgeon was worried that the MCL wouldn't heal well, and in future it might cause problems if it didn't heal well. So he put a plastic brace on it, which acts a bit like the frame of a building, giving structure to my MCL so that it will grow back with minimal stretch. And then he also did an ACL reconstruction arthroscopically, which means he put a few holes in my knee and some robotic arms and performed the surgery through just a few holes. So it's actually quite amazing how major the surgery is, and yet the wounds are pretty small. So the ACL reconstruction requires mine anyway, requires him to harvest my hamstring tendon. I think he only took one, and then he folded it over a few times, and he cut off my broken ACL and put the hamstring tendon on one side of the bone to the other side of the bone, replacing the ACL. And then he also also repaired my meniscus. So I had a radial tear on my meniscus, which means it was tearing across the fibers. And he said that when he got in to operate, it was actually in worse condition than he thought, or that he had seen in the MRI, meaning that he was trying to stitch together frayed ropes. When the ends of the ropes have frayed and they're loose, and trying to stitch them all back together, it's pretty difficult. But he did the best that he could, and hopefully it will heal and not cause too much troubles. The good thing about the meniscus is that it actually has the capacity to heal. Just hopefully it heals well and doesn't cause troubles in future. So what was it like after the surgery? So it wasn't too bad, because when you're in hospital you have a lot of pain relief. You've also got a lot of drugs in you helping you through the surgery. So the only thing is that it just feels a bit uncomfortable when you have to get up and go use the toilet. In fact, I wasn't allowed to get up to go use the toilet in hospital until a physio came to see me. So having to pee in a pan in hospital wasn't great. I was pretty groggy, so pretty much slept a lot in hospital. I wouldn't have minded staying a bit longer, but you know, they kicked me out pretty quickly, and got to go home. Unfortunately, my home has a lot of stairs, so stairs is a problem. Luckily, I am partial weight bearing after the surgery, which helps when you're going stairs. Just that extra leg for balance really helps. This is the third day of surgery, post-surgery I should say. Today's Saturday. I had surgery on Wednesday. And see that compared to my right knee, left knee is still really swollen and very puffy. My feet, look at that, really puffy. And yeah, haven't taken this bandage, still the same from the hospital inside, but a tube stocking lining. Gotta put a bag over my leg to have a shower. I think I have to keep this on and keep the dressing for 2 weeks. Yeah, hopefully my cankle goes away. Some pretty fat ankles. This one compared to my other cankle is not so bad. This is what it looks like. Interesting little section there. I guess that's where the hamstring was taken. And all the little holes that I have. And this it really hurts underneath as well. I thought there might have been a cut, but ever since the accident, it feels a bit strange underneath here. That muscle there is a bit of scar tissue. It's gone hard. And it always feels really tight. Yeah, strange. Yeah, wound looks okay. Not a lot of bleeding. Bit of bruising though. It feels weird. So it's day 6 post-surgery, and I am feeling better. I do have good days and bad days. During day 4, everything was fantastic. I felt like I could get off endone and all the hard drugs and was barely taking any Panadol. And then on the evening of day 4, it got really bad, and day 5th was really bad too. Just waking up in the middle of the night, really mainly having strange sort of pains in my butt region, sort of more to do with, I think, the muscles around the attachment of my hamstring was really tight, and everything felt really sore from my hip to sciatica nerve. I don't know what the pain was, but I got headaches from sort of clenching my jaws pretty tight. So it's not really just knee pain that is the hardest in the recovery. It's more like the rest of your body's just finding different ways to substitute how you walk on the crutches and sleep. You have to lay down on your back in one position for a really long time, and just generally a lot of tension and stress on the body, I guess. But you know, from one bad day to the next day, it's really good. No painkillers so far, and inflammation is probably a little bit down, not heaps. I've been raising my feet a lot, icing a fair bit. Apart from yesterday, we've had polar blasts. It's last day of autumn, and that's the other thing. Having knee surgery in autumn is very inconvenient because I'm finding it really difficult to wear anything but shorts, long pants, or leggings or stockings sort of right down. Can't really wear any tracky bags because every few hours you want to ice your knee. So keep warm, turn up the heater, and keep icing, raise the leg. Oh yeah, also getting up from lying down every morning is excruciatingly painful. All the blood rushes to your legs and you feel like all your wounds gonna explode. There's this tearing feeling and your blood's rushing into your legs. Your legs feel like they weigh a ton, and it's really stiff and awful. But you know, the pain sort of subsides after you get used to the blood flow, and especially when you start walking around a little bit more, it does get better. So today, since I'm feeling better, I thought I'll run through some of the exercises I've been shown. I think day 5, I was doing 10 reps and aiming for 5. So I did, and every rep that I did, you know, full power, trying to actually do the best that I possibly can and as hard as I could. I managed to get 10 reps of these exercises, which I'm going to show you, but was completely wiped out and had a lot of pain after. So I had a first appointment with my physio, who reminded me to just take it easy, you know, do it gentle, don't go full blown 100%, don't go 100%, go 80, maybe for myself after knee surgery, go 50, if it's better, go 60. I don't know what that ratio is, but anyway, I'll take you through the exercises that I was told to do. Okay, this is my setup at home. I'm often downstairs in a sofa, in front of the TV behind. So find somewhere comfortable where you are able to actually stretch your legs up flat. When you first start after surgery, whatever that direction or angle that your knee is in will feel the most comfortable after a little bit. So for example, if you've got a pillow, it feels more comfortable with a slight bend with a pillow in it. And when you first come out of that, it's really stiff and very difficult for you to even straighten your knee. So just take it easy, whatever it is, don't force it in a hurry, but do start the physio as soon as you can, because when you just finish your surgery, your leg will start to heal in the direction that it's in. So the more you do your physio now, the more able your fibers are to move. In the very beginning, when you first come back from surgery, it's important to encourage blood flow throughout your legs. And because it's so swollen all the time, and when you come home from hospital, they give you aspirin to thin out your blood because they don't want you to get clots in your leg. So the first thing you should do is to move your toes and, you know, make little circles and go different direction, clockwise, anti-clockwise. Another good tip, make little alphabets with your feet, A, B, C, D, and so on and so forth. That just encourages blood to flow into your feet and discourages sort of clots from forming. So the first exercise we'll do is knee flexion. And the whole idea of knee flexion is to try and bend your knees at, you know, a highest angle as you possibly can. Now it might be that you can't go very high at first, but that's okay. You go as high as you can. You can hold on to your brace to get that angle. You can even get someone to help you move your feet higher in the beginning, and just hold it for 10 seconds and then flatten it down again. The movement is important. The whole idea is to get your body sort of used to the idea that you've got to use these muscles that you haven't used for, you know, a month. For me, before surgery, it's been a month. I've had it straightened and haven't moved at an angle for very much. So there's a fair bit of scar tissue. So just move your leg, get it to different angles and get used to moving again and get the blood flow going. Now the second exercise that we're going to do is co-contraction at 0 degrees. The 0 degrees meaning your leg is flat. Now this is going to be hard to see in the camera because what you want to do is, what your aim is to push the back of your knee to the surface of the couch or whatever surface you're in. And the idea is to get your quads and your hamstrings to tighten and hold it for 10 seconds. So there you go, I'm holding it. It's hard to see, but I think maybe with this leg you can probably see more tension when you hold it. And when you haven't moved your legs for a long time, this part of your muscles really deteriorates, that part too, especially once you've had the reconstruction. I think one of your hamstrings missing, so there is a bit of disconnect, especially when you're stepping up. I find going upstairs, I almost have to drag my leg up. I can't activate the hamstrings very well. So start off small, start off gentle, and slowly and build your intensity. Now the next exercise is co-contraction at 30. So you want to try and move your leg to 30 degrees angled. I've been using pillows, and it's to get the pillows up. The idea is to get a 30-degree angle, and you lie down so that you can activate the right muscles. Lie down and do the same thing. So push the back of your hamstrings onto the pillow and activate your quads. Hold it for 10 seconds. And release. The next exercise is co-contractions at 60. So get your legs up to 60 degrees, as many pillows as it takes to get to 60 degrees. Push your hamstring, back of your knees down to the pillows and hold it for 10 seconds. And release. Do 10 repetitions of that. The next exercise is to actually sit up on the chair or on your couch or bed, whatever. And now this is co-contraction at 90. So you want to get your knee close to 90 degrees as possible. And this one, quite honestly, for the beginning, just sitting down like this is enough. But once you get more comfortable, the idea is to push down onto your leg gently. Again, for 10 seconds, hold it, and then let it go. Try moving it more and more to 90 degrees. I think at this stage, I'm able to do possibly 75 degrees. So just keep that angle as high as you possibly can, up to 90. And then I find just leaning forward and putting your elbows into your good leg and just stretching. This gives a little bit of more of an angle. It helps. And I find, because I'm short, depending on the chair, sitting out allows this to not rub onto the back of the chair, allows me to get a better angle, and leaning forward helps sort of make that stretch feel a little bit harder. Once you actually can bend your leg, you can get in the car and you can get out of the house and enjoy scenery, which is really nice. Enjoy some sun. You kind of get pretty bored staying at home, and there's only so much Netflix you can watch before it gets pretty boring. So yeah, enjoy being able to come out a little bit and get out of the house. Aim to get that 90 degrees. It makes it a lot easier for you to get in and out of the car and sit down, work. Being able to work from home has been really great, and getting down and sitting down has been indirectly a bit of physio while I'm working, so makes me feel like I'm doing two things at once. But you know, after a little bit, sitting down means your leg will swell up because all the blood will rush down. After physio, it's important, I guess, to actually get your ice packs ready. Raise your feet for a little bit and put some ice pack on it. I got this clay ice pack. It's quite good because it doesn't harden up. It kind of is a moldable material, and when it goes into the fridge, it still comes out without too much ice, so it's soft and moldable, and it has this little cover, and it's really big. So I found what I do is I put this at the bottom, and then this is another ice pack. This one was actually given to me from the hospital. This one's gel. The ice pack goes, it's like that, goes into the freezer. It's double-sided into sleeve, works very much like the clay. I put the cold side in without the insulation, and then this bottom one, I wrap it around. There's a Velcro string, and so you can actually have the ice above and below. And then I lie down like this so that my knee is higher than my chest. I'm going on to a week past surgery, and I'm actually enjoying the sun outside and feeling the breeze. It's winter time for us, but it's really lovely with a bit of sun, and on days like this where I can actually sit down on a chair, it's really lovely.